But there's tons of research going on right now about mindfulness and its impact on various emotional states, physical states. And the first that Jon Kabat-Zinn originally developed this to work with people who had severe and chronic pain. You know, like a roofer who's fallen off one too many roofs and is basically looking at a life of being on opioids, or, you know, or learning mindfulness and learning how to work with being in pain. And so we picked up, there's quite a bit of evidence at this point that it helps reduce depression, anxiety, eating disorders, stress, this feeling of tension, and pain, physical pain. Quite a few studies have documented increases in immunological response. So like if you get a flu shot, after having taken a mindfulness class, your body is much more likely to generate the antibodies to the flu than if you hadn't. That's the kind of study that would look at that. Reduced blood pressure, reduced cholesterol. Cholesterol is one of the stress hormones. And this is a squishy thing to say, increased psychological well-being. What does that mean? Well, it sounds good, doesn't it? But it is people basically reporting that they feel better. Enhanced cognitive functioning, there's quite a bit of research on that at this point, which is nice for those of us who are older and who worry about these things. Fibromyalgia patients improved. Cancer patients reported being more coping better with their diagnoses, with being on chemotherapy and things like that. We also see decreases in substance use. Whether people have an actual disorder or diagnosis of substance abuse, but still there's a reduction in actual use. So a person may, instead of smoking a pack of cigarettes a day, is only smoking 5 or 6 cigarettes a day, maybe. The thing that's really interesting to me, as somebody who teaches this stuff, is that these changes appear to persist. You know, when you take a pill and you feel some benefit from having taken an antidepressant or an anti-anxiety pill or something like that, when you stop taking the pill, that effect goes away, right? But the interesting things about learning mindfulness is that the changes appear to persist. Even this is assuming an 8-week mindfulness course with maybe 15 to 20 minutes a day of practice. And it's surprising to me that not only do the changes appear to persist, but they can actually document changes in the brain. The area of the brain that's sort of the fear center of the brain, the amygdala, actually shrinks. Amazing, right? And the gray matter, which is this executive functioning up here, that's not the gray matter, but that's the prefrontal cortex, that seems to develop more neurons. So there are actually changes at the neuron level and at the brain structure level, which is pretty interesting stuff.